Hey everyone, today I am here with Tirsa Baker from Renewed Play Physical Therapy. Tirsa, welcome. Why don't you tell everybody just a little bit about the clients that you serve and where you serve them?
Hi everyone. I'm Tirsa Baker. I am a physical therapist in Mesa, Arizona. I serve a lot of the East Valley of Arizona. So that includes Gilbert, Queen Creek, Santan Valley, and kind of the bigger Mesa area. I've been a pediatric physical therapist for 15 years, and for the majority of that time, I've been doing all in-home services to family. I just enjoy the pediatric birth to 21. I primarily work with the first year, the early intervention group of like birth to 3 years old. But yeah, I've just been here in Arizona my whole life, enjoying the physical therapy world. So it's been fun.
Awesome. Well, I think that's also super unique that most of your career you've spent in the home. I know for a lot of us pediatric physical therapists, that hasn't always been the case. But if you find something you love in a setting that really works, then, there is no real reason to leave it. Tirsa, would you tell everybody a little bit about why you love the home setting and maybe why you chose to stay there and practice in that specific setting?
Yeah, my biggest thing is I just love the families. I really like connecting with moms. They have so many questions. I also love the sibling aspect of it. I'm not a therapist that gets annoyed by siblings running in and doing different things or taking toys and running away. I really just like to incorporate them into therapy too, just because that's the child's everyday life. They're not going to be in the sterile therapy environment working on walking or working on crawling or whatever development they're working on. They need to know how to navigate throughout their own environment and with the distractions of everything else. Yes, I started in home a long time ago. We did some clinical rotations when I was a student, and that included clinic and home-based pediatrics. And I just gravitated a lot more towards the home-based setting. I did a little stint working in a clinic, and honestly, I loved it because I was still with kids, and there was so many tools that I could use, including hippotherapy and aquatic therapy. And I had everything at my fingertips, but I didn't have the parents. And that was one of the biggest things where I was, I just talked to them when I picked them out of waiting room, and then we went back, and then I talked to the parent for another 2 minutes at the end, and that was it. So just that collaboration with the parents and teaching them how to do what I'm doing is really what I missed in the clinic setting. That's why I chose to continue in home. It does have its drawbacks as far as driving around to homes in the heat of Arizona, and also just dragging toys with me everywhere. That can get a little hard sometimes, but overall, the payback is wonderful. So I really do enjoy going to people's homes and kind of seeing the environment that child is in usually.
I absolutely agree. I will say some of the funny times is when you're carrying an exercise step or some type of balance equipment, and the parent's oh, can I help you with this? And I'm like, you could get the door would be amazing.
Yes.
Thank you so much, because you're just trying to navigate stuff. Or I have this one family where this dad is the go-to therapy guy. He's working with me in the sessions, and then he's also the best at implementing with the daughter. And so we'll go up to the upstairs playroom to play, and I'll be working with the little girl because we're working on stairs. And so he'll be okay, what equipment do you want to stay down here? What equipment do you want to come up? And so he helps me carry things up and down the stairs. And it's really sweet to see the dads so engaged, and, the moms too, in therapy.
Yes.
And they almost get really excited about oh, what are we going to learn today? Not just the baby or the toddler.
Yes, it is very exciting. And obviously they're the ones that have to carry it out throughout the week. So if they don't know, the kid's not going to get as much progress through all those purposeful play movements that they're going to do on a daily basis. So I think being around the parents so much in a therapy setting is really important.
I totally agree. Now that you have your own practice, is there anything that you've implemented maybe that's different from when you're working for somebody else, or that you are excited to bring to Mesa, Arizona and Gilbert?
I would say, honestly, no, not a ton, because I am who I am, and I just give the families everything they need. Like in my prior job, I really would do what's best for the family. So I'm just continuing to do a lot of that. It is nice that I can do, if they want an intensive service where I come every day for a week, I can do that now. So I guess that in itself is different. I can really work around the family schedule a little bit more because I have so much more freedom in my own practice. But I would say, and also I guess treating them early. So that's a bigger thing too, is they have direct access here in Arizona to me. And so if a family wants to see me earlier, then insurance would provide, or even the early intervention services here in Arizona they'd qualify for, they can do that now. So early treatment, I guess, is what I would say I'm bringing into my practice that I wasn't before, which is a big deal.
And just for everybody at home or the moms in Arizona who are like Googling right now, like, I need to find an in-home pediatric physical therapist to come to my house. And that's a local that can really walk me through how my baby's moving and also some exercises to do. What does direct access really look like in practice? So I know physical therapy is probably something my kiddo needs. I find your website, Renewed Play PT. Is there a gap? Like, can I just call you right up? What does that look like?
Yeah, absolutely. So yes, in Arizona, you do have direct access to physical therapists. So basically, if you're a mom out there and you know that your baby isn't meeting a milestone of crawling, or if they're having a little bit of delayed walking, or even torticollis, that's a huge one that I see. They have that neck tightness in early infancy, or even just had a tongue tie release and you need some work done to release some of those restrictions. You can just go on my website and then request an appointment. Yep, just fill out that form, and then basically that shoots me an email, and I'm very quick to respond to families. I don't like people waiting too long, but that will send me an email with your information, and then from there I'll just respond. We can set up a quick Zoom call. I love to see the child and kind of see what you're talking about. If you don't want to do kind of a video consult, we can always do phone. But from there, kind of see what parents' goals are and what the child needs, and then we can set up an evaluation. So with the evaluation, I'll just come to your home, and based on that, I'll create a plan of care for your child. So again, I make sure every child is so individualized, so I can't say exactly what your child will need to get there, but I can kind of give you let's try this many number of sessions, and then from there we can see what kind of goals are made from there. So it should be a pretty easy and quick, just directly from mom to me. We don't need anybody else, thankfully, here in Arizona, because I know moms and dads have that parent gut that sometimes they just need to listen to and take action.
Absolutely. And I also think I really like to bring up for parents too, is that like, if you bring up your concerns to any healthcare provider, a pediatrician, a chiropractor, a midwife, or a lactation consultant, or really anybody, and they maybe aren't seeing what you're seeing, or maybe they don't see what you're seeing is as big of a deal as what you feel like in your gut it is, and you still want to have a physical therapist, professional opinion, consultation, ask some questions, or even just schedule that evaluation off the bat, is trust yourself, because at the end of the day, that decision is going to be something that you're going to potentially go over and over in your mind if something is going on and you took somebody else's advice when you knew in your gut that you really felt like, okay, maybe I need to keep looking at this.
Yes, absolutely. And I know that one of the biggest things for me is just bringing that peace of mind to parents about their child's development. I know that's on my website somewhere, but that's my biggest thing, because parents are always worried about something. And so I'm just here to kind of be that sounding board with the concerns, and then I can kind of look and evaluate through my clinical lens to see like, yes, your child does need this, or, it's okay. Let's wait a couple months. If they're not doing it by this time, absolutely come back. I'm here. I won't just tell people they need therapy just to need therapy, but I'll give you an honest feedback on where your child at. Because I know as a mom, we worry about everything. So sometimes it's nice just to bounce your ideas or your frustrations or your worries off of someone else. So.
Well, and I think too, parents really appreciate that creative lens to see movement through is, hey, there's a spectrum of things. And also parents are really capable. They are capable of so many things. Maybe you have an evaluation and you're like, okay, a lot of what I'm seeing is very mild, but here are the 3 things I would focus on over the next month. If all of these concerns resolve in the next 4 to 6 weeks, awesome. You can stay in contact with me if anything else pops up. Or if, you're implementing these things and it doesn't quite resolve, then, let's get the kiddo in. And then the flip side of that is, hey, let's just do, 3 visits now, see if we can resolve this really quick. And then you guys can kind of move on and not worry about it. So there's definitely benefits for each way of going. But I think what's nice about in-home pediatric physical therapy and also going with a practice where maybe there's 1 or 2 PTs, a lot of times we have more freedom in that than maybe like the corporate environment does.
Yes, absolutely. And I know for myself, I'm just kind of cash based. So we don't have to worry about qualifying through insurance. So that is nice when you mention, let's just do 2 to 3 visits and see if we can get this figured out. That's the nice part about kind of doing your own thing, and you can go that route with families.
Yeah. And I think too, like more of this style of healthcare is going to become more prevalent because it really is more proactive. And so the overall utilization of therapy can decrease if we're catching these things earlier. And also if we have the opportunity to teach parents all of these skills.
Yes, absolutely.
Okay, so we're on your website. Let's click around a little bit. I know you mentioned, you could have the evaluation, but also this online consultation. Can you kind of tell us the difference between an online consultation and just booking an initial evaluation?
So an online consultation is basically just a free talk with me, just so the parents can get to know me. It's a huge thing just to trust whoever your provider is. I know personalities are so different sometimes, and being in the pediatric physical therapy world, there is a lot of us. So we want to make sure that personalities mesh, or I'm who you're looking for. And then also just to know, like, if, like, I had one mom to reach out to me and she wanted certain days and times. And that was something that I couldn't do at the time. And so I didn't want to waste her time or her money doing an evaluation when we knew off the bat that wasn't going to work. So I think it's just a great way, 1, to meet me, but 2, just to make sure our schedules match. I'm who you want, and I'm the right fit for your family. So yeah, it's just an easy way to kind of get to know me a little bit and see what the next step is for therapy services.
I love that. And I think that's one of the things, it's one of the reasons why I love doing these interviews with other cash-based pediatric and home physical therapists, is that it just gives parents another touch point to get to know the therapist, learn about what's important to them, and then also just find them. A lot of my parents say things like, oh my gosh, like, I wish you existed, or this type of therapy existed when my older kiddo was a baby, because it would have been so much easier because I don't have to load the kiddo in the car and,
Yes.
Go to a place where, maybe the babe's not as comfortable. A lot of times parents just want life to just be less stressful because they're already on less sleep. They've already got a lot going on, and there's a lot to learn, especially if it's your first baby.
Yes, absolutely. And I do love the in-home environment, because I know certainly right now I'll have a mom that's like, my baby has been up all night. So I don't think our early morning time is going to work. Do you have a time where you're in the area later in the day? And thankfully I am able to kind of shift things around a little bit rather than just being in that clinic environment, one kid after another. So it is nice just in that realm, serving Gilbert, Arizona and Mesa and Queen Creek, just kind of being able to be in a lot of places, serving a lot of families.
I know before we hit record, when we were just chatting, we talked a little bit about total motion release. And for our families at home, a lot of times we talk about that as the shorthand, which is TMR. And I know that you recently took one of the courses to be trained in this type of therapy. And I did too. And I would love to hear just what your experience with it is. I know you love it and I absolutely love it. And I know you were saying too that there's not a lot of therapists in Arizona that are able to bring these to families. So I would love to hear just a little bit about your experience with that.
Yes. So like I said, I've been a pediatric physical therapist for 15 years. And so just in this past year, I took the total motion release TMR level 1 class. And it was really great. It just opened your eyes as a physical therapist to look at kids differently, especially those babies, why they may be crawling a little funky, or why, I see a lot of kids with torticollis again. And most of the time as pediatric physical therapists, we focus really on the neck. Why is it tilted this way? Why are they getting some of that tightness? But if we don't look at the trunk, we're missing a whole bunch of it. And that's a big part of TMR, as you know, is just looking at the whole body, looking at asymmetries. We never really think to look at the arms or the legs as much when we're dealing with neck issues, but just kind of looking at the whole symmetry and any kind of restrictions, working on that with little ones. It's really exciting. It's also exciting because it's painless for the kids. So instead of these, holding stretches that hurt for a long time, we're working with the side of ease. So it's nice for parents to see therapists working in a gentle manner like that, but seeing good results from it. So yeah, I'm very excited about TMR and what I can bring to the parents in Gilbert, Arizona with that. So it's a good little tool in my toolbox a little bit. So I'm excited for that.
Yeah, and I love too that it's just another layer onto all of the traditional physical therapy that we learned in school, as well as continuing education for all the parents at home. Just to give you a little insight into the world of physical therapy, both pediatric and adult, is that each state requires a certain amount of continuing education per year or 2 years. And so we are always continuously throughout the lifespan of our career taking new classes. And it's always great to stay up to date on the evidence, finding new techniques, learning from other pediatric physical therapists on clinically what's worked for them. And then every so often you find a course or a framework or a technique and you're like, oh, this is one of my top 10s, and you get really excited about it. And it can often even shift certain things in your practice. And it's always really fun to bring something different to an area. And like maybe there's a kiddo who's, had physical therapy in the past and it didn't quite resolve the things that they were hoping it resolved, or not quite made the gains or met the goals. And that can always be really frustrating for parents. And I think it's good for them to know that there are other styles of physical therapy that different types of physical therapists can bring. And just knowing that it's okay to try again. It's okay to go to somebody different. You can do these different things. Absolutely.
Yep.
Tirsa, you also mentioned something that I'm super excited to learn about. I don't know about the parents out there. It might be a little bit intimidating for them, but you talked about these week-long intensives where you would come once a day, maybe multiple times a day. Can you tell the families of Arizona exactly what this intensive would involve? Because that's a new style of therapy that I'm starting to see more of. And I think that's really great.
Yeah, absolutely. So I'll just take you back a little bit. I have, for the past 9 years, I've been working in Arizona's early intervention system, and primarily with those infants and toddlers. And through that system, at the most, families would get once a week of kind of that coaching model of therapy services. So it's hard when you're realizing your kid isn't meeting a milestone. They may not be sitting. So if I come once a week for the next 3 months, it may take a long time for your kid to meet that goal. So with now working in my own private practice and doing what the parents ultimately would like is meeting those goals faster. So as a parent myself, I would rather, let's push it hard for a week or 2 weeks and get my kid to meet those milestones faster than waiting 3 months, doing once a week therapy and then kind of just dragging it on. So I do offer some intensive therapies, so we can just do, once a day for however long it takes us, but kind of doing those services just in a quicker fashion to meet those milestones. So it is kind of intensive for the kids, but on the same hand, it's nice because they get to know you. You're not just like a new face week after week. It's like, oh, she's back. She's here again. And thankfully, I don't know if the parents out there that are listening to this know a ton about pediatric physical therapy, but we do a lot of play. So the kids will know that we're there to play with them. Yes, it might be a hard work and there could be a little frustration, but frustration is good. They're working through things that are hard for them, and that's why we're here. But with those intensive, you can see quicker results that you're looking for. I don't think any parents wants to wait 3 months to see their kid walk. That's why we're here. They want to see us. They want to see their child walk now.
They want They want to see their kid walk 2 months ago.
Absolutely.
Obviously, having patience, and each kid does develop, regardless of delays or not, at their own pace. But sometimes there are like very specific things in the orthopedic, like how the body is moving, what muscles are tight, activating those trunk postural control muscles.
Yeah.
And what we know from the evidence is just that strategic, more touch points can result in quicker progress. Yeah. And then also you can potentially get over that gap a little bit quicker. And like you said, I feel like kids are really adaptable too. And so one of my favorite compliments, I don't know, Tirsa, if you get this, but one of my favorite compliments with families is when they say things like, I'm just learning so much from you just on how you interact with my kid.
Yeah.
Like how you motivate them to do hard things, because physical therapy is not going to be the only hard thing that a kiddo does in the rest of their life, right?
Absolutely. Absolutely. And of course we have to make it fun so that they are motivated to do those things. So it is interesting to hear parents, see, like, notice how we do play and what tools we use, which is our toys, to get those kids to move in the direction we need them to, or just to maintain what we're working on. So it is really exciting for families.
Do you ever find too that parents are really interested in like things that you bring to the session?
Yep, absolutely. It's always like, or I'll get those texts like, my kid's birthday's coming up. Please tell me what toys would be great for this age. Or it's Christmas. Even on my blog, I'm not a huge blogger, but I did do like a Christmas, toy list based on ages and stuff. So they are very interested. But I also learn from families because I'll go into homes and see all these new toys after a birthday. So it's very exciting. But I always recommend, if there is a toy that they love and they absolutely love it, or have a basket of like, these are the therapy toys, because they need to be excited and motivated to move. So maybe just bring that basket out when it's time to work on, our home program or whatever exercises I have you do with them, and then put it away again, because we want them to be motivated and excited. So just kind of little tips that we provide families is fun that they don't think about.
Yeah, no, I think that's huge. And I'm sure it's just so natural, right? Like you're in their environment. You're like, oh, this would be great for this activity. Like, oh,
Yeah.
have you thought about, even for tummy time? Like I was just telling a mom, she was like, we're getting it, like it's working, but I'm kind of, I don't know, I feel like I'm like missing something. And I was like, well, I was driving at the time. I'm like, here are 7 ways off the top of my head that you could try to sneak it in that maybe you're already doing, but not consciously counting towards tummy time. Like, pull the pack and play out outside and do tummy time in the shade while your toddler's running around with the dog. Laying the baby on your chest or on your knees while you're talking to your husband. All of these things that it's really nice to have a physical therapist brain just like come to your house.
Yes, absolutely. And seeing that environment and what they have, or you can use this ottoman or this, this step for certain things, or looking for the perfect height of things is also fun because like I said, not everyone has those perfect little steps that a therapy clinic has. So what can we do to do that in your own home and use that as an example for them?
I totally agree. Is there anything from like a tip standpoint that you feel like you're telling parents like over and over again, or maybe even just this week that really pops out that we could just drop to the parents out right now?
I would say I really pay attention, especially when kids are working on like transitional movements. You don't have to be fancy with a lot of the stuff they're working on. So like most of the time a diaper box, save your diaper box because that's such a good level usually for the kids in that age, unless your kid is very, very small or taller than usual. That's a good size for getting that 90 degrees at the hips and the knees. So working from sit to stands if they're working on a lot of the pre-walking skills, or even just I had a mom contact me about high chair positioning. So again, just really pay attention to what the hips and knees are doing. So save those diaper boxes. Reach out to, if you do have a physical therapist, or if you know one in your area. No question is a stupid question. I have some great moms that just reach out about every little thing, and I am happy to help them because I know we, as physical therapists, just see things so different. So
yeah. And honestly, I don't know if you have noticed this, but I also feel like most physical therapists love to talk and educate. So it's like our natural state. I tell my families, I'm like, oh, you just get access to me for life. Did you know that? And they're
yes.
And I'm like, yeah, if your kid is like, 8 months old right now and we're good, we hit crawling, we're like doing all the things, but like at 6 years, you're like, I feel like catching is maybe off, or I feel like jumping is kind of interesting, or some coordination stuff. I'm like, email me. My phone number's never changed. Same as high school. Like, call me.
Yes.
Any of that, just because I think it's always just good to have a pediatric physical therapist bestie.
Absolutely. I completely agree. It's so funny that you say that, because I've had, like, one of my kids, I just saw her today, and I started with her when she was probably about 13. And then we worked really hard on a lot of things, and now she's 25, and her mom just called me and was like, she's having some shoulder pain, and now she's an adult, but we're having shoulder pain. So we're working, she really likes cupping. So we're doing cupping on, to get more shoulder range of motion. So it is kind of a lifespan thing. It's very cool just to have someone in your back pocket that you can ask questions to. But I like that we don't really go away.
Like, I mean, and there's times when like I'm busy, or like I don't get back to you right away, just based on workload and things like that. But almost every single one of my parents understands that, hey, like I'm reaching out because she you told me that I could, but they're always so gracious to me, and I appreciate that.
Yeah, absolutely. Absolutely. It's fun. They definitely, my family's become my own family members, and it's so wonderful to see. And you get sad when their oldest graduates, and it's all those mom moments that you feel because they're family to you.
I don't know, man. I feel like getting invited to those first birthday parties, you're like, how are you one? Or like, where did the last 3 to 7 months of my life go?
Yes. Absolutely.
No, you can't be one yet. That's not allowed.
It's very true.
Oh my gosh. So even though kind of going off of educating parents, you have a bunch of stuff on your Instagram. Is it cool if we pop over there?
Yeah, of course.
All right. So here we are. Let's see if I can find it. Okay. So tell us a little bit about what you post. Your picture's adorable. And I see that you have the appointment too. So if anyone found you on Instagram, they could also just go to this link, right?
Yes, absolutely. Yep. Very easy. I try to make it as direct as possible because I know people don't have a lot of time for things. So one click is always good. I just try to give families some ideas for things. It honestly is hard to figure out content kind of for Instagram sometimes because it's second nature to us. We're just like, oh, we love these toys, or this is how a kid sits. Doesn't everyone know it? But
I have the same problem on YouTube. I have to always ask myself, okay, what did I just teach a parent? And they thought it was amazing. Write myself a little bit. No, maybe that would be a good video.
It's very true. Very true. So I just try to take just what you said, what families ask me. So in this one, it's just about toys that kids love, especially that Fat Brain Toys Spin Again. Anytime I bring that to a house, everybody loves it. Just trying to think of different things for different ages that families can really just a one look. They see what's good. 6 months old. Here's some toys that I would use in therapy, and just kind of give parents some ideas on what to do.
Honestly, I love these types of posts too. I don't know, I'm not a huge shopper, but therapy toys, all day long. I will stock that stuff till the cows come home, because
it's very true.
Anything we can do to make the babies' lives easier, I feel is so important. I actually just got this little peanut ball because I was I had a stability ball, and I was I need something with a little bit more support, but also I love how you can lay babies over the side of it and stretch out their sides of their trunks and work on a little bit of head control things there. There's just so many things you can do with it. Is there any post on here that you would like to highlight?
My torticollis one has had a lot of people kind of review it. That shows a little bit. Yes.
All right. I see.
That one. Yeah, and that shows a little bit some of the TMR that I was talking about earlier. Just a different way. I know everybody just thinks that torticollis treatment, he's so cute.
He's so cute.
He's the sweetest little guy. But it doesn't have to be lots of tears when you're working in physical therapy with torticollis. You can do different things that are gentle, but still get results with these babies. So
oh my gosh. I love how you can almost see how gentle you are with this stretch. I've seen other people do this type of stretch before, and it isn't quite as gentle, but you can just tell that your handling skills are just gentle, you're going to the baby's tolerance, and that's something that parents definitely want to know is hey, I'm picking a therapist that is gentle. It's not always going to be rainbows and butterflies. There will be tears, but to know that like I'm grading it the best that you can to a baby. And if something is too difficult, it's okay to take a couple steps back so that those kiddos can be where their skill level is at, build on that, and then it's okay for us to make it more challenging later. We don't have to throw the kitchen sink at them right now.
Yep, absolutely. And I would say that I am definitely more on the gentle side with my therapy technique. And I pay a lot of attention to how the baby's doing, what facial expressions they're doing, and also the parents, because you have to earn, one, the baby's trust, but the parents' trust too. So if you're just going in there aggressively, that parent's not going to really love it unless they're looking specifically for that. But most of the time, I'm really good at reading the baby and reading the parent and kind of seeing what their needs are, and going with pushing the limits to what the child needs, but not too much.
Yeah, so. Absolutely. I love that. I love that you're bringing TMR to Mesa and Gilbert, Arizona. Also, I get jealous of everyone I know in Arizona, specifically from November to the end of May. It was still cold here in Wisconsin. So if you ever want to do, you find a continuing education course during any of those months, you just let me know. I
will. That would be great. Yes.
But, so I'm excited just for all the things that you're bringing to the families of Arizona. Is there anything else that you want those parents to know about you, about your practice, or about the way you treat?
Yeah, I would say you mentioned the weather in Arizona. That is one of the beautiful things. During the winter months, I like parents to know that therapy just doesn't, even though I come to your home, therapy isn't limited to your home. So I have gone to gymnastic centers, play places with families. I kind of anything they want, like Ninja Warrior places. And if their kid is really working on something, it's so fun. You can do so many different things within therapy. If I get so many questions on shoes, sure, let's go shoe shopping. I'll go with you to figure out something that works for your child. But then in the hot summer months, I just started aquatic therapy. So I'm in the pool with babies and kids. And so it's beautiful because you get to do a lot of year-round things. But I am not just the physical therapist that comes to your living room. I will go wherever you're needed to go.
Sorry, so. I've never heard it like stated in that specific way before. I'm like literally lost it. No, I love that too. I think the more creative we can be in allowing parents to understand that physical therapy is literally like how your child interacts any and everywhere they are. And how that looks and how we can troubleshoot things that are difficult. I think that's amazing. And I think your life also sounds really fun.
It is fun. A lot of people they think I must be the most exciting mother, but I'm like, I usually give all my energy to the kids at work. And then I come home and I'm a little tired. So no, I try to be fun for my kids. Yes.
And with the lights off. We're going to read books with the lights off.
Yes.
On the couch. And I will say that something that's interesting too is like a lot of times I love having my own practice because I can serve families in the way that I know works for me. And so I don't always, in total transparency, keep a huge caseload because then I'm not able to give my families what they want and what they need. And so sometimes I find, and one of the reasons why I love doing these interviews is because I find sometimes these cash-based mobile peds clinics or PTs are like the area's best kept secret.
Yes.
But I also feel like the families who are really looking for us find us.
Yeah, that is true. It is very exciting when you find those families that really love you and need you and you're able to provide that for them. And so like you said, the caseload thing is huge because where I came from, I was just overwhelmed. And I didn't have time to go home and research what that child needed for their next therapy session. And with this and doing my own thing, I really can. I can take courses that I really want, whether it's lactation and working more with those tongue tie kiddos or babies, and then or the TMR and specific needs for these families where they have tried the clinic therapy, they've tried early intervention and nothing's working. Well, I'm here and I have the time to do research for specifically for your child, because I don't have that crazy caseload, and I can provide more of that concierge service just for your child. So it is kind of like a little secret that we can provide for the families in the area.
And I love it. Also, we're going to have to get you back on the channel because I love that you are getting into the world of tongue ties. I don't know if you can like see my book over here.
Oh, great.
Oh gosh. There you go. So I bought it. It's huge though. And I was a little bit like a little intimidated. So I haven't cracked it open quite yet. Trying to get all my YouTube videos posted.
Yes.
But, I do know that it's a huge area and it affects so much, and the fascia goes from your face to your toes. And
yes.
So if a kiddo does have tongue, lip, cheek ties, it can be really huge impact in their movement. So I love that physical therapists are on board with this.
Absolutely.
This treatment and knowledgeable about the conditions.
Yep. And I think as physical therapists too, it's just so important to look at the child as a whole. How is eating going? How is sleeping going? How do they have any sensory issues? We're not just looking at those motor milestones, even though we do, but that's only one component to their daily life. So I personally will ask so much about the child because I think there's so much that we're missing if we just stay focused in that one area. So it can give us a lot of clues as to why they're doing things or why they're having difficulty with a lot of things just based on what we ask the families. So
yeah,
it's fun.
I totally agree. And I think too, it's interesting because you have so many more opportunities to ask some of those questions because like there's the kitchen, there's the bedroom, like we can actually see these locations. And then you can ask like, oh, I know you tried, like one time I did like an entire high chair ergonomics evaluation and
Absolutely.
We were really struggling. And so we were trying to modify the high chair so that it best fit this kiddo.
Yeah. Yep. Which it plays over into a very important role in the family's life. It can make mealtime a whole lot easier. It maybe just because that PT came and helped supported the high chair situation. And now the kid is a little more independent during mealtime. So it is a big thing. And so families,
I don't know,
just don't know that about us.
I'm just gonna do the rest of the interview like this and see how my body feels, right? Like if a kiddo is fully over here, like they're not gonna want to sit for very long in that position because it doesn't feel good to their body. Yeah,
it's a lot of work to sit like that, let alone swallow or try to get nutrition from that. So it's a big deal.
Oh my God, Tirsa, it's been amazing. Is there anything last minute that you want to share about your practice or about yourself?
I think my biggest thing is I love to love on families. My job is to serve you. So I just want to be able to meet as many families and serve as many families and just love on you as much as possible. That's really where my heart is. That's why I started Renewed Play. There's a lot that went into that name that means a lot to me. So when you, like you said earlier, when you get me for life, and you get a lot of me. I have such a passion for families and loving them. So yeah, that's Renewed Play Physical Therapy.
Well, I don't think that you could have said it any better because like that touched my heart. And I know that there is a mom out there like grabbing the Kleenex right now. Like, oh my gosh, how can I get Tirsa into my house? Because that is not present in healthcare. Yeah. Most of the time.
Absolutely. And so I would say empathy is probably my biggest thing. I will think and think and think about your family or your child until I can, I'll text you, how is it going? How was this doctor's appointment? I don't stop thinking about your child usually. So it could be a good thing for families, bad for my own, but I do love you with all I have. So yes.
Well, I think that they appreciate it. Well, it has been an absolute joy to have you on the channel.
Thank you.
And we'll have to do this again, 100%.
I would love it. I would love it. Thank you.
You're welcome. Have a good one.
You too.